I'd like to welcome Dr. Kirshat Bozkurt, who has been a leader not only in his local, regional, and national and international societies, but also has been a real asset to the Vein and Lymphatic University. So, Dr. Bozkurt, who are you? Who is Dr. Bozkurt?
Good question. First of all, I'm a cardiovascular surgeon. In our country, still we are cardiovascular surgeons, but in the last 10 years, I'm doing mainly only phlebology. So 90-95% of my work is now only phlebology. I worked for a while in United Kingdom. Then I came back to my country. It was 1996, and then I decided to be a vascular surgeon. Then I became mostly a phlebotomist. Then I became professor in 2003. I decided, okay, Kushat, you have done enough for yourself, for your university, for young trainees in your faculty. You should do something more for your country. Then I decided to work for the societies. Fortunately, in my country, in Turkey, there are two societies actually working together. They are not competing, they are working together. One of them is Turkish Society of Cardiovascular Surgery, and the other one is Turkish Society of Vascular Surgery. In vascular surgery, we are dealing only with vascular patients. In the biggest society, we do cardiovascular business. Then I did a lot of job for the societies, and I became the president of Turkish Society of Vascular Surgery first. Then, 2 years after, I became the Turkish Society of Cardiovascular Surgery. That means there is no other society I can be president in Turkey. Then I started to think internationally. What happened is in 2015, I went to Korea and I started to do something for UIP as well. But before that, in 2013, I became the president of Asian Society of Vascular Surgery. Asian Society of Vascular Surgery is also a very big society. I mean, at least 20 countries we have in Asian Society of Vascular Surgery. And in the meeting in 2013, I did in Istanbul, we had registration 1,800 people. It was a really big meeting though. Then we did another Asian Society of Vascular Surgery meeting last year, again in Turkey, in Antalya. We had 2,000 registrations there. These were two really, really big meetings. I am also still the council member of Asian Society of Vascular Surgery, and in the Asian part of the country, we are world. We are doing very good job with Asian Society of Vascular Surgery and Asian Venous Forum. Really training, and it was a very good opportunity for the young doctors in the Asian part of the world. In the meantime, Turkey has a different position, Asia and Europe, a bridge. So we are also very connected to European part. I'm working for ESVS, European Society of Vascular Surgery, for 20 years now. And fortunately, this year in September, I will be organizing together with the president of Sebastian Debus, the European Society of Vascular Surgery meeting in Istanbul, which is also around 2,000 registration we are expecting in this meeting. This meeting for arterial and venous sign. So my aim until now has been to do everything for the societies, for the training of the young doctors, and our eventual aim is to give better health service to our patients. This is very important. Although it is time consuming, although it is sometimes painful, for 20 years now, nationally and internationally, I do my best to do this thing. And together with you, it was a very good event. We did Mexico mission a couple of months ago. I don't believe me or not, but this is one of the most important, satisfying projects I did in my life. It was very good event. I mean, we talk a lot about this one, but It was very good. We did very good job all together with you, with Lowell, with Victor, with all together. We did very good job. It was very good though.
So can you go into a little bit of the details of the humanitarian mission to Guadalajara a few months ago for Vein and Lymphatic University? How did you organize it? How did you put it all together? What were the goals? Because that's tough to do. It's a lot of work.
Yeah, correct. First of all, you yourself, Lowell, Victor, asked me, Kürşat, can you do a humanitarian project together with us? Because specifically Lowell and Victor knows how much I wanted this one. You know, sometimes patient is important. I wanted to do. And with the help all of the VLU executive committee, first of all, we decided to do that event in Mexico. There are some other choices. For example, we thought Cuba, but for some logistic reasons, we couldn't do it. Then we end up with Mexico. In Mexico, locally, we had Rebecca. She was very nice. She was very important, and we worked all together. We did a lot of patients. There are more than 40 patients, something 70 plus legs. And what we did is we trained the people. It wasn't just doing the cases going back. No, it wasn't. We specifically, all of us, uh, aimed to train the young doctors there, which means after us, they can do all of the new technologies there. And we did all of the new technologies on superficial vein treatment there, and it worked very well. The next country will be possibly Vietnam. Then the next country would be Nigeria, or recently there are other possibilities as well. But we will continue together with VLU this project.
So I wanted to step back about what makes a good leader. What are the qualities that a leader has to make? Because you've been a leader on multiple societies at the local level, all the way up to the international level. What are some of the keys to success for leadership?
First of all, leadership means dedication. This is the first issue. Just consider your parents. I mean, without expecting anything, they did a lot of things for us throughout their life. A leadership, and specifically in medical area, leadership means without expecting anything, you should do something for the patients, for the young doctors, and for the countries, specifically underdeveloped countries. In my understanding, in leadership, in medicine is this ones. The first aim is to give a better health service to the patients, then train the doctors well, and if possible, go to the underdeveloped countries and teach specifically the doctors there. My aim for this reason as UIP started in 2015, as I small if as I told you before, and I became the general secretary of UIP in 2022 in Istanbul. For 3 years now, I'm trying to do better things for training, for science, and also to improve the economical financial situation for UIP. My aim is now as a leader, candidate of leader in UIP, to improve the economical situation, financial situation of UIP, to increase the scientific level. For example, we should prepare new guidelines, well-developed guidelines. There are still a lot of confusion in guidelines. One guideline says this one, the other guideline is saying the other one. So instead of different guidelines, Union International Philology should work with other societies and to have a one clear, correct, independent guideline. For example, we should do that. And for this aim, we created the group. I mean, my understanding in leadership is not to be one man. It's not a one-man show. For example, in our team, we are altogether 12 people, and each person should have a responsibility. I understand leadership is like that. So one person should do one subject, the other person is to subject, and at the end, we will do all together everything for the sake of patients and young doctors. That's why we decided as a group to run for UIP elections. I don't know how it will end, but scientifically and as a person, as a group, we are ready for it. Leadership is dedication, and I hope we will do all together with my team.
That sounds great. Thank you so much for agreeing to do this podcast and specifically for being the leader and dedicating your time and resources for so many years. We really do appreciate all the effort that you've put together internationally, nationally, and locally. So thank you so much.
My pleasure, and my pleasure. Thank you. Thanks a lot.